Most of us can remember this time last year when the world was introduced to COVID-19, forcing us into a lockdown. The deadly pandemic leaving people to die alone in hospitals, highlighting health disparities in Black and brown communities, and doing damage we can't even begin to measure. From the beginning, people prayed for a cure, anything to try and combat this deadly virus. And finally, the news we had all been waiting for, late last year, a vaccine. A vaccine that, despite the need, isn't making it into the arms of people in Black and brown communities. Coming up in this next half hour, we aim to figure out why.
There's a lot of bad stuff that we know about COVID-19. I don't know any really bad stuff about the mRNA vaccines.
History of systemic racism and institutional racism has always been a barrier to health care.
To me personally, I don't feel it's enough research on me as a Black woman, and I don't feel it's enough research as a whole.
Especially in this age of COVID-19, is that we not have this mantra of the distrustful Black person, that somehow it's in the DNA of Black people to be distrustful.
This is different. This is our system prioritizing Black and brown folks in ways that, honestly, they haven't before.
Well, it all started last fall. COVID struck my family in 2 households.
When you first hear the COVID-19 survival story of Boyzell and Andrita Hosey's family, it sounds like a lot of stories we've heard during this pandemic.
I had COVID and was hospitalized with pneumonia. My wife had COVID. She recovered. My daughter had COVID. She was asymptomatic. She recovered.
That was just at their home. Boyzell points out it only takes him about a minute to walk to his father's house down the street. He never imagined COVID-19 would get to his dad's house just as fast and as deadly as it did.
My dad, who was 91 at the time, he was in declining health, and he was never really diagnosed with COVID officially. But when I look back on the events, I'm pretty certain that he had COVID because he went down really fast. And my brother, who was his caregiver, he ended up dying from COVID.
And all of this happened in the span of 1 week last November. The week before, Andrita's brother Bob came to visit from North Carolina. The deadly virus took his life too.
My father-in-law was the first to pass, and then my brother, and then my husband's brother. My father-in-law was Thursday, my brother was Saturday, and my brother-in-law was Sunday.
That swift and sudden loss at the hands of COVID-19 is something so many in Black and brown communities know about all too well. CDC data shows African Americans are 2.9 times more likely to be hospitalized for COVID-19 and 1.9 times more likely to die from it when compared to their white counterparts. The numbers for Hispanic Americans and American Indians are just as devastating. Dr. Ulrich Simmons is the Chief Medical Officer at Advent Health. He talked to us more about why Black and brown communities are being hit so hard by COVID-19.
The reality of it is that 70% of the inequities that we see and the outcomes are caused by what are known as the social determinants of health. Access to care, food instability, housing instability, lack of follow-up, and then socioeconomic disadvantage. Healthcare, if you are wealthy, is easy to obtain. When you have to make the decision whether you should eat or get your medication refilled, that's a very difficult place to be. And so there is not any one answer, but it is a multitudinal conglomeration of things that impact.
Velma King's family experienced the impact of those startling numbers firsthand. She remembers every detail about the week she spent in the hospital after contracting COVID-19 last summer.
I couldn't sleep. I had to literally sit up because I was afraid of dying in my sleep. It's so crazy because the room that I was in, my dad was in that room and he had COVID for 6 weeks. And he was in that room, was gone out of that room a week before I got there. And only thing I could hear, and I'm trying not to cry, only thing I could hear is my daddy saying, "I got you."
It was a comforting nudge she knew her father, Willie Robinson, would have given her if he could. Instead, the man who she looked to as a hero was now in an assisted living facility, free of COVID-19, but battling blood cancer. His family only able to see him in his final days through a window.
We had to visit him, and it was the worst thing ever. We had to see him through a glass, and he didn't have a clue of what's going on. He's like telling us, open the door and let me out.
King says shortly after that, her father died from blood cancer, all alone in a facility. A month later, her mother died from heart failure. The family believes she died of a broken heart after losing her husband. King and the Hosies both had their health tested and their hearts broken by COVID-19, but their reactions to the news of the vaccines are very different.
Very hopeful, yeah, very enthusiastic about it, but also, thinking about, the history of medicine, in the Black community and as an African American, you think about things like, oh, okay, well, is this going to be safe? Can we trust it? And you always go back to things like the Tuskegee experiment, and I had many conversations like that, with friends, but I quickly came to the conclusion, doing my homework and studying and seeing who was involved. I quickly came around to saying that this is a good thing.
I will not get the vaccine because I personally don't feel like the vaccine has been tested on somebody like me. I don't think they took a 200 and something pound 38-year-old woman and did any type of research on her at all. And I feel like as a Black woman, I am looked upon as being that guinea pig, and I'm nobody's guinea pig.
We took King's concerns to Dr. Karina Rodriguez at USF Health. She's overseeing Novavax's COVID-19 vaccine trial that's currently underway at USF. Now let's talk about diversity with clinical trials. How diverse were the participants for this Novavax clinical trial?
That was one of the priority, and trying to at least have between 10 to 15% of African Americans and Latino participating in the trials, and then people that have some either comorbid conditions, or they may be at a higher risk of exposure because of their work, or other, type of social situations.
The Novavax vaccine isn't available in the U.S. yet, and while it sounds promising that Novavax and other clinical trials are including people of color, when you look at the number of people in Florida vaccinated so far based on race, it's a different story. In this snapshot in early March, data shows Black people are being vaccinated in significantly lower numbers. It's a trend we're seeing nationwide. So what's behind those low numbers for African Americans being vaccinated? We heard two words, trust and Tuskegee. I'll look more into that coming up after this short break. You're watching Justice for All, Vaccination Hesitation on Spectrum News. When you mention healthcare in the Black community, there are a number of things you'll hear, trust or lack thereof it, and four words that spark fear in the hearts of many. The Tuskegee syphilis study is something we wanted to find out more about. When it comes to history of healthcare in the Black community, there are the things we know and the things we think we know.
To our African American citizens, I am sorry that your federal government orchestrated a study so clearly racist.
Betty McDuffie knows more than most about the 40-year-long government-funded medical study that changed the way Black Americans feel about health care. Her grandfather was part of it, and he had no idea.
So they would examine the men, physical examination, blood work, etc. And if the men were diagnosed with syphilis, they would set them aside for one group. And if they examined a man who did not have syphilis, they'd set him aside for a second group. So these groupings became the experimental group and the control group. And I was able to determine my grandfather was in the control group. He never had syphilis.
Her grandfather, Colonel Griffin, raised her. He was a father of 7 and once worked as a sharecropper in Tuskegee, Alabama, a community with no access to health care, hit hard by syphilis in the early 1900s. It's what many believe is the reason researchers chose this community, Black men in particular, to become unknowing participants and the victims of the United States Public Health Service syphilis study at Tuskegee from 1932 to 1972.
They had no intention of helping the men. They just wanted to see what damage the syphilis would do to the physical body of these men. About 1942, the medical community discovered that penicillin was very effective against syphilis. Penicillin was widely available to anybody who had syphilis, but they wouldn't give it to the men in the study who had syphilis. They withheld that treatment, and they allowed those men to suffer until they died.
McDuffie says her grandfather died before ever finding out he was a part of the study and labeled as patient number 212 out of more than 600 men involved in the study. Another name on that list was Freddie Lee Tyson, Lily Tyson Head's father.
That was quite a shock. We were angry, we were disappointed, we were confused, and we wanted to know more. But my father could say very little because he didn't know much about the study.
She learned the men were not injected with syphilis. Her father didn't have the disease and lived well into his 80s. And he didn't find out about the study until decades after it ended. Her father shared stories he could remember about the people who suffered from syphilis in Tuskegee, stories Tyson Head often hears at meetings held by the foundation Voices for Our Fathers, a foundation formed by the descendants of the syphilis study.
Well, there were quite a bit of stillborn births during that time. Now, this is all from my grandmother, who was a midwife during that time. And my father also told the story of how some of the men were terribly, terribly sick during that time. Again, they did not know that they were in a study, and they did not know that they had syphilis.
Dr. Vanessa Northington Gamble is a physician and medical historian. She was on the board of the Tuskegee Syphilis Study Legacy Committee. That group helped to make this apology from then President Bill Clinton happen, decades after the study ended.
On behalf of the American people, what the United States government did was shameful, and I am sorry.
When I was in the White House and heard President Clinton say those words, and we are sorry, there were audible sobs. There were audible sobs because it was as if the president was not just apologizing to the men and their families and the people of Macon County, but also to Black Americans.
In her role as a professor at George Washington University, Dr. Northington Gamble teaches about the history of other medical atrocities in the Black community, like the case of Henrietta Lacks.
She was at the Johns Hopkins University Hospital, and her cancer cells were taken. And her cancer cells were used for the basis of a lot of modern biology.
In both the syphilis study and the case of Henrietta Lacks, the people involved had no idea they were even a part of a study. We talked with licensed mental health counselor Dr. LaDonna Butler about the lingering impacts of these studies.
Historical trauma is real. We carry in us and in our very DNA stories that are passed on or transmitted from our grandparents, our great-grandparents. See, we learn from our relationships, and we learn from lived experience, not just our own, but the people who have helped us to get where we are right now.
Butler says hesitation and trust issues people of color may have when it comes to the COVID-19 vaccine are valid.
There is this idea that there shouldn't be fear associated with the vaccination. I think one of the ways we can combat that is just to be honest, that this country historically has not done well with health practices, especially concerning Black people. So there is a valid distrust of our system. we need to name that. We need to name it, and then we need to respond to it in a way that people can do what is in their best health process.
Ahead, I'm getting the answers to questions about COVID-19 vaccine research and digging deeper into some of those concerns about vaccine accessibility. We've heard a number of people question the COVID-19 vaccine. What's in it? How was it created so fast? And what were the demographics of the people involved in the clinical trials? I went to try and get the answers to some of those common questions you all may have and to try and clear up some of those uncertainties. To get the COVID-19 vaccine or not? That is the question in the Black community. At least that hesitation is what many are associating with these low numbers of African Americans getting vaccinated. But is there more to it than that? Bethel Missionary Baptist Church pastor Reverend R.B. Holmes thinks so.
We want all people vaccinated, all people. But we know now less than 5% of African Americans and other minorities have been vaccinated as of this moment. Those numbers, unfortunately, are very perplexing and perturbing. That's part of the reason why he formed the statewide Coronavirus Vaccination Community Education and Engagement Task Force out of his Tallahassee church. He says government officials need to do more to get shots in the arms of people of color. Let's make sure that we have sites that are accessible and available to people in these isolated, distressed communities. Holmes says they tried to present their plan for wide distribution in Black communities to the governor, but got no response. Now he says he's in talks with the White House. Right now, the state's health departments are teaming up with select local churches and community centers to distribute the vaccine in Black and brown communities. In Pinellas County, the health department is partnering with the race equity nonprofit Foundation for a Healthy St. Pete.
Foundation for a Healthy St. Pete is putting on RFQ to actually go door to door with an iPad, go to some of the community meetings to help register them. So I think we need to do more of that, making sure that there's phone numbers readily available to the community and making sure that they get registered to even the pod sites, because we want all the access points.
In the state's first phase, those 65 and older experience problems on vaccination registration websites. Couple that with what experts call a digital divide in the Black community when it comes to computer and internet access, and you start to see the impacts firsthand in these long lines at vaccine sites with less than a handful of Black people in some locations and none at others.
So let's be perfectly clear. The beginnings of the enrollment process was awkward for many, difficult for some, strained and strange for others. But that doesn't mean we stop. We have to try something anyway. And so in the beginnings of it, we didn't see the numbers we wanted to see. We will see the numbers in a new strategy.
In Tampa, outreach plans have been in motion for quite some time. Dr. Kevin Sneed with USF Health says their We Care program has been doing medical outreach in Black and brown Bay Area communities for years. But like most of us, they've had to move their critical outreach message online.
I give a 20-minute presentation, but then I might be on that Zoom call for another hour, just answering questions. Dr.
Sneed is answering important questions that would leave some scratching their heads.
The wildest belief I've encountered has been that the vaccines will turn you into an animal. Now, when I hear that, I don't blink an eye, I don't roll my eyes, I don't do any of that, because you know what? At that moment, that's their reality. So I sit there and I listen and I say, well, no, let me tell you why that can't happen. And the other part that has really crept up lately has really been that, and again, we don't really have good science, and so I can tell people the best information I have, that if I'm a woman, that the vaccine is going to sterilize me. And I say, well, no. It's not interacting with any of your reproductive organs. As a matter of fact, it's really almost not even leaving the shoulder we shot it into.
Another reoccurring question he hears a lot: how was the vaccine created so quickly?
These are not brand new sciences and brand new vaccines. We've been working on these now for an 8-year period, and it was designed with the next pandemic in mind. So I want people to know that we didn't wake up in April of 2020 and start working on anything brand new. we began implementing a plan that started back in 2013 and 2014.
He says part of the problem is some people just don't know enough about the vaccine. The National Institutes of Health is hoping to change that with a new initiative called SEAL, which is a community engagement alliance against COVID-19 disparities. Dr. Keith Fernandez is the SEAL committee co-chair. He wanted to clear up some misconceptions when it comes to the vaccine safety.
We've had enough of millions of persons who've been injected, almost 1.5 million daily right now. Let's think clearly. The fact that you only hear these really, really weird, isolated stories about this person got the shot and died 2 weeks later, or this person got the shot and got this reaction, the fact that those are highlighted means that there are millions and millions and millions of people who got the shot and there's nothing to report. There's no story to tell. There's nothing to tweet. There's nothing to paste into Facebook. And in fact, the overwhelming majority of people who get the vaccine with the mRNA, other than the pain in the arm and somewhat of a feverish or low-grade fatigue, they don't feel anything at all.
Since seeing is believing for most people, we've created a visual way to understand the vaccine. You should first know both Moderna and Pfizer's vaccines are not made with the actual coronavirus. Instead, they use a genetic code for a spike protein that coats the surface of the coronavirus called mRNA. By injecting that genetic code, the body's cells make up some of those harmless proteins, just enough for the immune system to respond, preparing it to react later if it encounters the real virus. The recently approved Johnson & Johnson one-shot vaccine does not use mRNA, but Dr. Fernandez says he doesn't think the pathway Johnson & Johnson uses makes their vaccine any more or less safe than the others. To spread the word even more, a number of people are sharing pictures and videos of them getting their vaccines as a way to show their families that it's safe. Lily Tyson Head and Betty McDuffie, whose families were directly connected to the syphilis study, both got their COVID-19 vaccines. McDuffie is taking it a step further. She's now participating in a clinical trial related to the COVID-19 vaccine. And while she says she's more concerned about vaccine accessibility, she acknowledged the hesitation people may have as a result of the syphilis study.
I understand it. I understand their hesitancy. I really do. I would encourage them to take the time they need to do what they need to do in order to be comfortable with taking it.
Velma King says she's taking some time, but as of now, she hasn't changed her mind.
For those that do choose to do it, God bless you. But it's not for me. And maybe in 4 or 5 years when they've done research on somebody that's like me, maybe I will.
As for the Hosies, they say they will be the first in line when they're eligible for the vaccine, and they're hoping their story inspires others to do the same.
The science is there. You know, I'm a person of faith, but I also believe in the science. I just think that, you should just do the right thing. You know, not only think about yourself, but think about the potential impact of others.
If this pandemic has taught us anything, it's personal responsibility. Each of us will make a choice about what's best for us and our families. But the reality is not everyone is going to get the COVID-19 vaccine. A mental health expert offered this perspective. Don't shame people who don't want to get the vaccine. Instead, listen to their concerns and educate them about the facts about the vaccine and leave room for them to change their minds if that's what they choose to do. It's just another reminder that we're all in this together. Thank you so much for watching Justice for All, Vaccination Hesitation. I'm Sandra Weathers with Spectrum News.